Hello everyone, my name is Dr. Amr Abdulafar Mahmoud. Today I am discussing a cohort prospective study. Retrograde trans-popliteal axis is an alternative to field antegrade femoral axis in TASCII femoral popliteal occlusive disease single study. Disclosure: I don't have any potential conflict of interest. Background: peripheral arterial disease is usually caused by atherosclerosis that causes stenosis or blockage in the major vessels supplying the lower limb. Approximately 10% of the world adult population have peripheral arterial disease. In patients who are not at high risk of surgery, bypass surgery is indicated for long, more than 25 cm superficial femoral artery lesion when an autologous vein is available and life expectancy is more than 2 years. Endovascular treatment is an attractive alternative to open surgical procedures for peripheral arterial disease. This is a subgroup study of prospective non-randomized cohort study to detect the role of endovascular management for surgical high-risk patients with TASCII femoral popliteal occlusive disease. It detects the role of trans-popliteal retrograde axis in total superficial femoral artery occlusion TASCII with a patent popliteal artery as alternative to antegrade femoral axis. Patients and methods. This is a prospective non-randomized cohort study. Included 54 surgical high-risk patients with TASCII femoral popliteal occlusive disease. It is a single-arm clinical study with no comparison with open surgery results. The protocol was approved by a local ethics committee of Ain-Shams University Hospitals, and all patients signed an informed consent form. Inclusion criteria: Number 1. Clinical diagnosis. Adult patient with history of critical limb ischemia as defined by Rutherford category 4, 5, and 6. Surgical high-risk patient as grade 3 or 4. Intact femoral pulsation or patent iliac arteries. Number 2. Radiological diagnosis. TASCII femoral popliteal occlusive disease. Detected radiologically by ultrasound or CT angiography. Chronic total occlusion of superficial femoral artery more than 20 cm. Popliteal occlusion or both. Number 3. Written and signed consent obtained from the patient. Picture number A. Total occlusion of the superficial femoral artery. Picture number B. Total occlusion of superficial and popliteal. Number C. Total occlusion of the popliteal artery. All are representative of TASCII femoral popliteal occlusive disease. Exclusion criteria: Provocation or asymptomatic lesion Rutherford 1 to 3. Severe diabetic foot infection that is not salvageable. Patient who underwent previous intervention, bypass as a target limb lesion. Acute ischemia. Patient refused to participate. Pregnancy. Non-allergy to contrast or antithrombotic medication. Life expectancy is less than 3 months. Resultant: 54 patients were included, 14 men and 40 women. There were 42 participants or patients underwent contralateral retrograde axis and 7 ipsilateral antegrade axis. And we have 5 patients received ipsilateral retrograde axis at the popliteal artery that represents 9.3%. Technical success was high with contralateral femoral axis followed by antegrade femoral axis and loose with popliteal retrograde axis. 60% success or technical success rate. So the conclusion: trans-popliteal retrograde approach can be accomplished safely and efficiently using a medical infracondyle retrograde popliteal puncture with the patient in the supine position. Furthermore, this retrograde popliteal approach can be considered as a valid alternative for femoral or proximal popliteal artery recanalization after failed antegrade approach.